right, second set of these, we're going to do her adductors. So, very first one, we're going to hit adductor magnus. We're going to go oblique fibers. She's going to be full external rotation. She's going to slightly adduct, and I'm going to pull her into adduction. Good. Let's do that again. Try to keep this knee straight and hold. Good. I'm going to have you lay on the same side, actually. Yep, you can see. To deformat this, we're going to be ischial tube just medial to the hamstring. So we're going to drop right in there, right at the rings. Excellent. And then middle third of the linea aspera. And the femur there. Good. Lay back. Retest. Full external rotation, abduction. Good. And that's stronger. To do the picks, she'd be in that same position. She completely relax. And I would have her keeping that external rotation, pull into my hands. 6 times 6-second holds. Excellent. So those are the oblique fibers. For the vertical fibers, she's going to be full internal rotation, keeping the knee extended. Don't let me pull up. Excellent. Lay on the same side again. We're going to be at ischial tube again, just medial. The adductor tubercle, which is a little higher than when we were on the middle third. And then the lower middle femur. I was actually wrong. Adductor tubercle is lower, not higher. So we'd be ischial tube, and we'd be down here at adductor tubercle. And that lower medial. Good. Lay back. Fully internally rotate your hip. Hold there. Excellent. So we would have her relax to do the picks, and she would push down slightly. 10%, 6 times 6-second holds for that. For adductor longus, both legs are flexed about 30 degrees. She is going to externally rotate and adduct. And then I'm going to pull her. I'm going to pull you out, Kristen. Hold, hold, hold. Good. So I'm pulling her into abduction. To deformat this, I'm going to have her gently relax here. She is going to kind of use her hand to block a little bit through kind of her pelvic private area. We're going to get into pubic tubercle. I could even have her point out kind of where her pubic bone is. There. Yep. So we're going to drop into pubic tubercle. And then the inferior half of the linea aspera. Push out into my hand. I can feel longus here. Good, and relax. And we're going to drop right in there. Good. On your back. I'm going to retest. Flex. Externally rotate. Slight adduction and hold. Good, relax. And if we were doing the picks, she would pull into my hand. Good, and relax. And I'm making sure she doesn't come up into flexion, that we're coming straight adduction. I could even use my hip to help guide that a little bit as well. Excellent. Adductor brevis, full hip internal rotation. She's going to flex up and cross midline into adduction. And I'm going to pull her into abduction. Good. To deformat, we're going to be same area, kind of right under the longus here. So push into my hand. Good. Follow the longus tendon. I'm going to drop a little inferior to that. And then we're going to hit kind of pectineal line, middle third between the hamstring and the quad. Excellent. We'll retest. She's going to internally rotate, flex her hip to 30 degrees, adduct, not let me pull. Good. Relax completely. For the pick, she'd pull into my hand. 6 times, 6-second holds. Excellent. Pectineus, full external rotation. She's going to flex and adduct. I'm going to push her down and out. We'll retest that one again. Hold. Your SI joints is popped. Ooh. All right, we're going to be at the same area. Relax for me. Got a block. Find the longest again, push into my hand. We're going to drop a little more inferior even. And then work through the pectineal line. That's good. Retest, external rotation, flexion, adduction. Don't let me push. Good. And relax. And if we were doing our picks, same thing. She's pulling kind of up and in into my hand. Gracilis, she's going to fully internally rotate. She's going to adduct slightly and not let me pull. Good. For this one, again, inferior ramus of the pubis and the ischium. She's going to block. We're going to be a little more posterior. And then we're going to work into that medial pes group. Excellent. She is going to internally rotate, adduct slightly. Don't let me pull. Good. And we do our picks, same spot. Hold, 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 and relax. Hamstrings. So we'll start with semi-membranosus. So she's going to be 75 degrees of hip flexion. She's going to internally rotate the hip, internally rotate the tibia, keeping that full dorsiflexion. She's going to drop her knee to 80 degrees of flexion. Don't let me pull up. Hold, hold, hold. Good. Semi-tendinosus, we're going to be kind of same position, but only 75 degrees of hip flexion. We're going to internally rotate the hip. We're going to internally rotate the tibia. Keep that knee dorsiflexed. 110 degrees of knee flexion and hold. Excellent. Flip on your stomach for me. Defamat for semi-membranosus. We're going to be at the ischial tube, just lateral of the midline. Good. We're going to find the tibia. We're going to be that posterior aspect of the medial condyle of the tibia down here at insertion. Semi-tendinosus, we're going to be in the same spot of the ischial tube, just a little bit lower. And then we're going to pull into my hand gently. Follow that semi-tendinosus down to where it inserts on the pes. Good. And to retest, flip on your back. For membranosus, 75 of hip flexion, internally rotate the hip, internally rotate the tibia. She's going to flex to 80 degrees and hold. Good. For semi-tendinosus, same thing, 75 internal. She's got flex to 110 and hold. We would do our picks in the same position. Pull into my hand gently. Good. And for membranosus, same thing, but from that 80-degree knee flexion. Excellent. Biceps femoris will do long head. So she's going to be 75 degrees of flexion. At midline, she's going to dorsiflex and externally rotate the tibia. We're going to flex the knee to 70 degrees. Don't let me pull out. Good. Flip onto your stomach. We'll deformat that. posterior lateral ischial tube. And we're going to come kind of to that lateral head of the fibula, a little posterior. Good. Flip back over. Flexing the hip 75. She's going to externally rotate. We're going to flex down to 70. Don't let me pull. Excellent. For the short head, we're going to do the same thing. Flex, externally rotate the tibia. She's going to flex to 110. Don't let me pull. Excellent. DIFA mat would be the same, except lay on your stomach. Instead of being up at the ischial tube, we're going to follow down to that lower 1/3 of the femoral shaft. And then that posterior superior head of the fibula. Good. Lay on your back. We're going to retest. Hip flexion 75, externally rotate down to 110. Don't let me pull. Good. And then we do our picks in that same position. Vastus medialis, the upper fibers. She is going to be in that 90-90 position. We're going to fully externally rotate the hip. We're going to drop down to the level, kind of heel level of the opposite medial joint line. She's going to internally rotate her tibia. She's going to plantar flex. And then she's going to not let me pull. Hold, hold, hold. For the medial fibers, same thing. She's going to be plantar flex, internally rotate the tibia, externally rotate the hip. Don't let me pull. Good. For the lower fibers, same thing. Don't let me pull. Good. To deformat these, we're going to be at the upper third of the linea aspera. You can kind of feel where that vastus medialis is. This is for the upper fibers. Then we're going to hit superior medial patella. Middle fibers, middle third. Good. Lower fibers. We're going to hit that lower third. And then the medial patella. And we'll retest one of those. Full external rotation, full internal rotation, full plantar flexion. Don't let me hold. Good. To do the picks, same thing. She's going to push into me. And we do it from all three positions. For vastus lateralis, we're going to be on the opposite side. She's going to fully flex. She's going to internally rotate her hip. Oops, sorry, table's moving. She's going to externally rotate the tibia and stay in plantar flexion. And don't let me pull. Good, that's for the upper fibers. For the middle fibers, we'd be mid-shaft of the tibia. For the lower fibers, we'd be opposite of the medial malleolus. To deformat, we're going to be on the lateral border of the greater trochanter. So, finding greater trochanter through that lateral border. In the middle part of the linea aspera, for the middle fibers, lateral inferior part for the inferior, and then we're going to be superior, kind of lateral patella tendon, and then lateral kind of tib fib area. And then we'll do them on the side we actually treated. Good, and then we could retest. Just flexing down to 90. externally rotate, plantar flex. Internally rotate the hip, externally rotate the tibia, plantar flex, and hold. Don't make pull. And pulling her into internal rotation. We would do the picks in that same position. Here, internally rotate, externally rotate, pull out in my hand. Good. And we could do those in all three. Vastus intermedius, she's going to be hip flexed as far as she can, or to 110 degrees. Externally rotate the tibia, flex down to 110, push up into my hand, hold, hold, hold. Good. To DFMAT, we're going to be on the anterior lateral surface of the femur. So just lateral to the IT band. Just medial to the IT band. The upper 2/3. And then we're going to be superior patellar tendon. Quad tendon, all the way down into the patella tendon. She's going to flex to 110, externally rotate the tibia, flex the knee to 110, hold, push, push, push. Good. And to do her picks, same thing, hold up, push into my hand, 10%, 6 to 6. For vastus intermedius, the medial fibers, we're going to be in that exact same position, but she's going to internally rotate the tibia, hold. Good. We're going to DFMAT that more medial surface, just under the rectus. The upper 2/3 of the femur, quad tendon, patella tendon. Good. She's going to flex, she's going to flex, she's going to internally rotate and push. Good. Articularis genu, 20 degrees of hip flexion, 20 degrees of knee flexion. We're going to push up into my hand from the hip and the knee. Excellent. We're going to DFMAT, superior patella, kind of right in that little space, and then down over patellar bursa on that superior part. Good. 20 and 20, push up. Good. Relax. To do the picks, push into my hand. Good. Excellent. 6 to 6 second holds at 10%. All right, scooch down medial gastroc. Scoot back just a little, right there. Perfect. She's going to be in the half calf position, so we're going to bring her here. She's going to fully plantar flex. She's going to internally rotate the tibia. I'm going to pull her knee into extension. This is for the medial head. Excellent. For the lateral head, same thing, but she's going to externally rotate. Good. Lay on your stomach for me. For the medial head of the gastroc, we're going to be in that medial femoral condyle. Posterior inferior. We're going to work all the way down through the medial calf to that superior medial calcaneus. So we can work all through there. Good. For the lateral, same thing, but we're going to be a little more lateral. Work all the way down through the lateral part. Good. Into that lateral calcaneal area. Good. Flip back over. Boom. She's going to be flexed. For the medial head, she's going to be internally rotated and then hold. Good. Retest for the lateral head. Good. To do our picks, she'd stay in that position. Pull back into my hand gently. And I'm not holding her here. This is just my bracing. And same thing. Hold. Good. Plantaris, same position. She's gonna flex. She's doing full plantar flexion, not rotating the tibia at all. Don't let me pull. Good. Lay on your stomach. We're going to hit the lateral condyle of the femur here, just above the gastroc to deformat. We're going to find that little musculotendinous junction behind the knee. Good. And we're going to hit superior medial calcaneus. Good. Flip back over. Same thing. Scooch down just a touch, mid-calf. Bone, pull full plantar flexion. Don't let me pull out. Good. Popliteus. She's going to be 90 degrees of hip flexion, 45 degrees of knee flexion. She is going to keep her foot neutral and internally rotate the tibia. I'm going to pull from here. Don't let me move you. Hold, hold, hold. So I'm pulling her into external rotation from that first med head. To deformat, lay on your stomach again. We're going to start up high at that lateral condyle of the femur. We're going to follow that down at the angle. We can bend if we want. And we're going to hit that medial 1/3 posterior part of the tibia, kind of following that 45-degree angle. Lay back on your back again. Scooch down, half calf position. She's going to internally rotate. She's going to let me pull, hold, 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 keeping that foot into neutral. Soleus, lay on your stomach. We're going to flex the knee to 90 degrees. We're going to internally rotate the tibia. So relax for me. So I want you to just turn just your leg in. You're going to fully point down and curl your toes. Don't let me pull down. Pulling from that first med head. Good. For the lateral head, same thing, except we're going to externally rotate, full plantar flex. Don't let me pull down. Good. To deformat for the medial head, we're going to drop in deep under the lateral head here of the gastroc. We're going to go middle third of the tibia. And then to the lateral calcaneus. For the medial head, same thing, we're going to drop in deep. Deep in there to that medial calcaneus. Good. We'll retest. Lateral head, plantar flex. Don't let me pull. Good. To do the picks, same thing. Pull into my hand, push, push, push. Excellent. Push, push, push. And I'm making sure not to grip her here, but just help support gently. And then the opposite. Same thing, hold. Excellent. Flip over, peroneus longus cuneiform division. Scooch down just a little. Full plantar flexion. She's going to abductor foot. And then we are going to pull her, I'm sorry, you're going to be here. So we're doing perineals. She's going to be full plantar flexion abduct. Do not let me pull it in. Excellent. For the metatarsal division, she's going to be plantar flexed adducted. Do not let me pull you up. Good. And then for peroneus, or I'm sorry, flip on your stomach for me. For the cuneiform division, we're going to hit for peroneus longus, kind of that lateral fibula, superior third. And then we're going to hit lateral side base of the first met. And at the cuneiform. Peroneus longus. We're going to do the same thing. That's superior lateral fibula. First met in cuneiform. Flip back over. Boom. We're going to have her abduct. And I'm going to pull her. She's going to fully plantar flex. And I'm going to pull her into. Hold on. So she's here. She's abducted. And I'm going to pull her into adduction. Good. And then for the cuneiform, she's going to be here. She's going to be adducted. And I'm pulling her into dorsiflexion. And we would do our picks from those same positions. Peroneus brevis, she's going to be same position, full plantar flexion, slightly abducted. I'm sorry, slightly abducted. And then I am going to pull her into adduction. Good. Lay on your stomach. We're going to be a little lower. We're going to be middle of the lateral fibula. Probably do this one on their back too if you wanted to. And then we're going to be at the base of the fifth metatarsal. So that's for the posterior division. Good. Flip back over. And we'll retest. Boom. Slight abduction. Don't let me push. Excellent. For the brevis, for the fibular division, she's going to be in this half cap position, full abduction. She's going to dorsiflex and evert, and don't let me push down. Excellent. To defamat, we're going to hit that anterior third of the fibula. And then the met heads on the dorsal surface of the fourth and fifth. We'll do it on this side. Good. We'll retest. So she's going to plantar flex. Or I'm sorry, she's going to fully abduct for the brevis for the fibular division. She's going to dorsiflex, evert, and not let me push down. Excellent. To do your picks, pull up into me. Good. Keeping that eversion and abduction. For Tertius, she's going to be in the same position. She's going to fully dorsiflex. She's going to evert. She's going to curl her toes. And don't let me push. Good. We're going to hit that inferior portion of the anterior fibula. And then the dorsal medial base of the fifth met. Good. Boom. Full dorsiflexion. Evert. Curl your toes. Don't let me push. Excellent. To do the picks, 6 to 6. Hold, hold, hold at 10%. For posterior tibialis, the tibial division, she's going to be in that same half cap position. She's going to fully plantar flex. She's going to adduct. Do not let me pull you into abduction while she keeps that. We're going to hit lay on your stomach for me. We're going to hit, for the tibial division, we're going to hit superior third of the posterior part of the tibia. And then through the fibula and the interosseous membrane. And then the plantar surface of the navicular, cuneiforms, and the second through fourth metatarsals. Good, flip back over. Half calf, full plantar flexion. We're going to adduct. Don't let me pull. Good. For the fibular division, we're going to be in the same position, but she's going to adduct and invert, so more up and in. And I'm going to push down and out. Excellent. For this one, we're going to hit a little more lateral on the tibia. Okay. And then we're going to still hit our 1 through 5 med heads, navicular, cuneiform, cuboids, get all through here. Good, we'll retest. Dorsiflexed. She's going to adduct and invert. Don't let me pull. Good. Intertibial division, same position. She's going to be in that half calf. She's going to fully adduct. She's going to dorsiflex and invert, curl her toes. Don't let me push down. Good. To deformat, we're going to hit the lateral portion of the condyle of the tibia, and that's superior third. And then the first met on the plantar surface. Good, we'll retest. Full adduction, she's staying in neutral here. Dorsiflect and invert, curl your toes. Don't let me push down. Good, we do our picks. Again, I'm not holding her here. Same position, she's pulling into dorsiflexion. Good, 10%, 6 times 6 second holds. For the interossei division, she's going to be in that same half calf position. She's going to fully dorsiflex. She's going to invert. No adduction, she's going to curl her toes. And then we're pulling from that first med head into plantar flexion. We're going to hit lateral tibia. And that's superior third. Plantar surface of the cuneiform, slope a little higher, and first med head, and we'll retest. Full dorsiflexion, she's going to invert, curl her toes, don't let me pull, good. For the picks, pull up and into my fingers, good. 6 times 6 second holds.